Good morning. Today is Tuesday, August 19th. This is Wake Up with KERA News, and I'm Andrew Garcia. The heat advisory we've been under continues. Highs are going to reach 102, but they'll feel a lot more like 108. The National Weather Service is reminding people to stay inside unless you must go out, and be sure to stay hydrated. Coming up, a new study suggests teens spending too much time on cell phones may be at risk for cardiometabolic disease. The connection after the news. North Texas universities are likely to lose thousands of international students and millions of dollars in tuition. KERA's Bill Ziebel reports it's because of recently changed state and federal policies.
UT Arlington's draft budget for 2026 lowers undergraduate enrollment projections by 300 students. The school says that's because of the end of in-state tuition for students without legal status. The university also projects it'll lose 40% of international students who typically pay full tuition. Fanta Av, who leads the Association of International Educators, says those students no longer feel welcomed.
Given that there were revocations of visas and cancellation of student status record and so forth.
Av says her organization estimates the loss of international students will cost Texas universities $300 million in tuition and fees. For KERA News, I'm Bill Ziebel in Dallas.
A Bedford resident was diagnosed with West Nile virus in the city's first case of the year. Both Bedford and Tarrant County have seen mosquito samples test positive for West Nile virus over the summer. Tarrant County officials confirmed the county's first positive human case in early July. The Tarrant County mosquito season typically runs from April to November. Teens spending too much time on cell phones and electronic devices may be unhealthy. A new study suggests it may put them at risk for cardiometabolic disease. Cardiologist Dr. Carl Horton with Texas Health explains cardiometabolic disease and how it ties to excessive phone use.
Basically, cardiometabolic disease kind of refers to a compilation of risk factors that increase your risk for developing cardiovascular disease in the future, as well as type 2 diabetes. Things such as high blood pressure, high cholesterol, obesity, those are kind of some of your main risk factors.
So how would this tie to excessive use of cell phones and electronic devices?
It was kind of more of an association between screen time and also the amount of sleep between children and adolescents. So I looked at their total screen time, whether it was with a cell phone or playing video games or TV or in front of a computer, and they looked at that screen time and the amount of sleep, and then they also did measurements of the children to kind of come up with a risk score of what they thought their risk of developing cardiovascular disease would be in the future.
Is this about the amount of time they spend on screens, period, or maybe them spending too much time at night on screens?
Probably refers to a little bit of both, because we know that if you're in front of a screen for several hours per day, you're usually less physically active at that time. With regards to the timing of the screen time, usually if you reviewed the study, there was a comment that people that are on their screens late at night, that it may affect with the total duration of sleep at night. And so it's known that blue light from screens can affect perhaps the amount of melatonin that's produced, and melatonin helps regulate your circadian rhythms as well as the amount of your sleep-wake cycle. And so it's thought that being on screens too late is bad overall for your sleep regulation and then subsequent cardiovascular health.
And all of this puts you at higher risk for cardiometabolic disease.
That's correct, in the future. And we've already seen, children, adolescents who are, the rates of type 2 diabetes has been increasing in that population. There's a lot of things related to that. Some of it, of course, is related to diet and processed foods, but a lot of it is also related to physical inactivity.
I understand you see this in your own home.
Of course, everybody does. Anybody who's raising children now, we know it's a struggle to try to keep them off of their devices and also to try to get them more active. And so as a parent, you also want to encourage your children to put those phones down early, set parameters, and then also make sure that your children are staying physically active by doing some type of sports or other activity. I treat, of course, mostly adults, but I do usually ask in terms of how much physical activity they're doing per week. I also will ask a lot of patients in terms of the amount of sleep that they get per night. And so I think for pediatricians out there and those that treat adolescents, they got to, definitely hone in on those questions a lot earlier.
Of course, it really isn't just a problem, though, for teens.
It is across the board. Also, this study kind of looked at two previous cohorts, and it was based out of Denmark. But I think what would be more interesting if they could put it together would be kind of a long-term randomized trial looking at this from a small community, kind of like the Framingham study, but follow kids through adolescence and young adulthood over, let's say, 30 to 40 years, and kind of get a more accurate assessment of the potential risk of exposed screen time as well as sleep duration.
Of course, I guess if you use the cell phone the right way, you could use that to enhance your health.
And we've seen that some also with smart devices, such as the Apple Watch, where patients can really track their health, track their number of steps that they're taking, Fitbit devices. So technology can be used for good, but it just has to be used for good and not just strictly, other things.
That was KERA's Sam Bekah speaking with Dr. Carl Horton from Texas Health. The Rangers lost last night's game against the Kansas City Royals. They continue to flounder as they see their playoff hopes dwindle. They currently hover about 6 games back out of the final wildcard spot. They'll play Game 2 of their series with the Royals tonight. Soak up the end of summer vibes at the North Texas Fair and Rodeo. Enjoy food, country music, and of course, the rodeo through the 25th. For more information and to find some other fun things to do, visit our Go See DFW calendar at kera.org/calendar. Thanks for listening to Wake Up with KERA News. I'm your host, Andrew Garcia. The show is produced by Shardae White with editing support from Bekah Morr. For more news in your inbox, visit kera.org/wakeup. That's where you can subscribe to the Wake Up with KERA News newsletter. You'll get a more in-depth look into the news with plenty of good morning vibes. Connect with us on Facebook, Instagram, and TikTok at KERATX. Take care. We'll see you tomorrow.